Hi everyone, and on this day which has been dedicated to creating awareness about sexual and reproductive health, I wish you a very good health on both accounts. And let me tell you something, some myths and how you can keep yourself healthy in both ways. So these are basically two topics, sexual and reproductive health. So these are two different things, and of course, reproductive health and sexual health are related to each other, but they are two different things. So let's start with the sexual health first. So the things that I would like to create awareness about in sexual health is that commonly people come to us with sexually transmitted diseases. I think it has been more than several decades, more than 4 decades that condoms were made available free of cost at certain government hospitals and other places. So we shouldn't really be seeing any sexually transmitted diseases in the 21st century, but it's a very unfortunate when we come along people that who come to us suffering from sexually transmitted diseases, and very common one of them is called as gonorrhea or gonococcal urethritis. Even syphilis to some extent we see, and other viral diseases like human papilloma virus, which can often be responsible for cervical cancers and penile cancers in men and cervical cancers in women. So a lot can be done to avoid these problems, and but the basic thing is to have sex with protection. So one must not consider, many times people come and say that they had a casual encounter in a club and they call their partner as their friend, but that is not true. That their friend who has had a casual encounter with them could be going around with several other men. So basically one has to be careful about who he's having sex with or who she is having sex with, and always use protection, and never ever should one have sex other than the spouse without using protection. So that is one very basic thing, and using a condom, a simple condom, prevents you from all these larger problems in life that can happen. Now there is another aspect of sexual health which is concerning the mental makeup, like erectile dysfunctions or reduced libido. Libido means a desire to have sex. So, and especially there can be certain, the same problem can affect women also, who can have a reduced desire to have sex, or some women will have vaginismus, which is like they will contract their bodies and will not allow their male partners to have penetrative intercourse. So all these problems can be sorted out by good counseling, and first of all being aware by maintaining a good physical health, like running and walking every day can lead to a better sexual performance because it increases blood flow to all organs of the body. So basically saying that if you maintain a good physical and mental health, the sexual health can be maintained likewise. So being healthy mentally and physically will definitely result in a better sexual health. So now coming about the reproductive part, a very important thing that I want to draw your attention to is that when we were studying medicine, we were told that one should get into a family way before the age of 30 years. Nowadays, we see that many women have not born children till 35 or 40, even beyond 40. So the incidence, so why this is medically important is because the incidence of genetic problems increases after the age of 30 years. So your child can have a higher risk of landing up with a genetic issue after the age of 30 years. And also many times we see certain women achieving menopause much early. Normally we say that the menopause comes around 45 years of age, but many times we see that they run out of their eggs or they achieve an early menopause. Somebody I've seen in my clinic as early as 38 years of age, they've had menopause and there are no eggs, so they cannot bear children, and they have not even yet started to plan. So that came as a rude shock to that woman. So my request to you all is to at least get yourselves checked up. There are certain blood tests that can tell you that what is your fertility potential. So similarly, men can undergo a semen examination to check their fertility potential and maintain the best of sexual and reproductive health.